Nasal polyps. What are nasal polyps or polyps nasal? The smart answer is that nasal polyp is an overgrowth of tissue inside the nose and are considered non-cancerous. I am Rena, consultant herbalist and healthcare content writer from Herb Concept, and if you like, be sure to subscribe to my channel. To better understand what is happening, we need to talk about what should be inside the nose. Normally, inside your nose is a line of pink, squishy tissue called nasal mucosa. It is a thin layer of cells that lines the majority of the inside of your nose, although there are some areas that can be quite thick. In fact, over the course of a day, some parts of the nasal mucosa become swollen and inflamed, and sometimes you can really feel that happening. Nasal polyp symptoms. Polyps can grow large enough to block a person's nasal passages, resulting in chronic suffocation. It may have the following symptoms: feeling of nasal congestion, runny nose, excess mucus clearing from the back of the throat, also known as post-nasal drip, decreased sense of smell, inhale and exhale only through the mouth due to nasal congestion, insomnia, snoring. Polyps nasal causes. What happens if something goes wrong? As they say, this particular nose is allergic to pollen. In people with allergic rhinitis, it starts a series of inflammation inside the nose, and one thing that can happen, in the setting of chronic allergic rhinitis, is that the nasal mucosa becomes so irritated. It starts to grow and spread around. In fact, chronic allergic rhinitis is the main important cause of nasal polyps. And after a long period of swelling, this particular patch decides to get a little bigger and a little thicker. At first it may be a little bumpy, but over time that bump can get bigger, and it can get bigger and bigger and bigger, unless it's big enough. In people with polyps, the polyps grow into the inflamed tissues of the nasal mucosa. In fact, the mucosa is a very wet layer that protects the inside of the nose and sinuses and protects the air that provides breathes. During irritation caused by an allergy or infection in people, the nasal mucosa becomes inflamed and reddened due to inflammation, and it can produce fluid that, in the case of prolonged irritation, usually drips. The mucosa can form a cyst-like polyp which can obstruct the nasal passages. The main cause of the formation of polyps is the human body or impurities in the blood which, instead of dissolving or excreting, stop inside the body and cause polyps, besides the apparent symptoms which can be permanent or persistent bone infections, asthma or shortness of breath, the presence of contaminants in the blood. Facts about polyps nasal. Nasal polyp looks and feels like it's working a little bit like a tumor, and it's a kind of neoplasm, but it's not a malignant process. It just hangs in the nose, but it's not a good thing at all. The nose is a sensitive area. There are so many things that need to happen. There are many things that you may not even realize that you have a runny nose. As we know, all our sinuses live very close to our nose, and if such a large polyp decides to get in the way of these sinuses, it can cause further problems and complications with chronic sinusitis. Before we get into some real-world examples, we must take a look at some more facts about nasal polyps. These are actually very common things, at least in adults. This is one of the most common internal development that occurs. However, if we look at it in children, it is very unusual. In fact, in children, it is more common in patients with cystic fibrosis. Another interesting fact to know about nasal polyps is that there is an association with other types of allergic disease, but especially with a combination of asthma and specific allergies to aspirin. Many people would call the combination of allergies to asthma and aspirin and nasal polyps an allergic triad. But we will look at some real-world examples. Diagnosis of nasal polyps. The nasal polyp is usually visible by raising the nostrils of the nose with the hand and giving it a bright light. A CT scan or MRI scan is necessary to determine the exact size and location of the polyp, which accurately diagnoses the polyps and also shows that the polyp has damaged the bone in the area. Different allergy tests can help determine the cause of persistent nasal inflammation. In the case of nasal polyps in young children, diagnostic tests are required to diagnose genetic diseases such as cystic fibrosis. Anatomy of nasal polyps. Now, the first thing to go for is some normal anatomy. If we take a CT scan of a patient, but before we go to a patient who has polyps in the nose, we need to point out a few things. Mass effect just due to the presence of the actual tissue itself causes obstruction to things like sinuses, to the tear ducts that drain into the nose, and to the eustachian tubes which drain the ears. The tear ducts are up here at the front of the nose, these are also called nasolacrimal ducts, and the eustachian tube that runs out to the nose is located at the back. Are nasal polyps serious? So far, there is no evidence from research, studies and experiments that nasal polyps have been linked to cancer or have been shown to be fatal. However, they can cause a great deal of discomfort and interfere with the normal drainage and ventilation of your sinuses. The purpose of the mucus produced by the sinuses is to wash away irritation and contaminants from the nasal passages. However, according to the information and research so far, it is not a fatal disease and there is no specific indication of any fatal disease in the near future. Although many people fear that it may be a cancer-like disease or a sign of cancer in the near future, it is a serious misconception that it is usually a harmless disease. What happens if nasal polyps go untreated? However, according to research and studies so far, if nasal polyps are not treated, nasal polyps can eventually block your nose, and the presence of these polyps in the nose can make it harsh to breathe through the nose. Bone infections may be more common. In severe cases, nasal polyps become so large that they can be easily seen by peeking into the nose and easily felt by touching them with the finger. Risk factors of nasal polyps. If particular polyp gets any bigger, then patient runs the risk of obstructing that eustachian tube and causing problems with his middle ear. They can occur up at the front of the nose here. They can occur down at the back of the nose here. They can occur at one part of the nose and then extend in a tubular fashion to another part of the nose. Every polyp is a little bit different, and most of the symptoms from these polyps will depend on exactly where they are. Things to do. There's a few things that you should do. The first thing is you should always try and get rid of what's causing the inflammation in the first place. In most cases, that means treat the allergy and purify the blood. Sometimes that only partially works or might not work at all. In that case, your second line of therapy is oftentimes surgery. Now, while both of these treatments are good, there is a chance with either one of them that nasal polyps can recur. And some patients may undergo long treatments to get their inflammation under control or have multiple surgeries to get rid of the polyps. Nasal polyps treatment. There are several treatments for nasal polyps that are effective in nasal polyps. The surgical treatment is the most common, but it can also be eliminated by oral medicine and can be prevented from recurring. However, surgical procedures are now very common. Surgery of nasal polyps. During endoscopic surgery, the surgeon inserts a small tube with a bright magnifying lens or small camera called an endoscope into the patient's nostrils and carries it into the bone marrow. He uses small devices to remove nasal polyps and other substances that block the flow of fluid from your sinuses. Beneficial herbs for nasal polyps. 1. Figs. Figs are a popular fruit and have an important place in dried fruits. They are sweet and delicious in taste. Its temperament is hot first degree and wet second degree. It is used both as food and as medicine. In its special function, it softens the retained material and dissolves it and removes it from the body. Since it also has the characteristic of expelling waste material from the body, its main advantage is that the acidic and impurities that remain in the body can lead to nasal polyps or similar. Figs softens, dissolves and removes these waste products from the body, and in addition to nasal polyps, it cures external skin and internal polyps, swelling and sores. It expels waste to the visible body. 2. Colocynth. Colocynth is very useful herb known its botanical name Citrullus colocynthus and belongs from Cucurbitaceae family. It is a very popular herbaceous herb whose leaves and vines are like melons. Its fruits are small melon-sized. In the initial stage, the fruit is green, but when it matures, it turns yellow. Both its fruit and fruit pulp are used. All the ingredients of this plant are used as medicine. They are very bitter in taste and its temperament is hot and dry. It has the properties of excretion of phlegm, solvent. It dissolves phlegm and waste products from the body. Since this herb is used in excess of the recommended dose, it causes intestinal cramps and feeling of restlessness and nervousness. In starts, it should not exceed the prescribed dose and should be used on the advice of herbalists. 3. Indian rhubarb. It is the root of an herb with a yellowish-black color, a bitter taste and a pungent odor. Its scientific name is Rheum webianum and its family is Polygonaceae. Chewing in the mouth makes the saliva yellow. Its main properties include expulsion of phlegm, stagnant substances and impurities from the body. Whether they are in the blood or have stopped somewhere in the body system or have taken the form of a polyp, it is used to dissolve and remove polyps from the body and also have very high properties in healing the affected area after dissolving. This herb with many good properties that can be used as an external ointment for external skin ulcers and oral medicine for internal sores. 4. Raisin. It is actually a dried grape, but it is a dried fruit of a large grape. The dried fruit of a small grape is called a raisin, while this type is a large raisin cleaned of nuts and its temperament is warmer first class. In herbalism, raisin has been used for centuries to treat various ailments. It is used to dissolve and remove polyps from the body and also have very high properties in healing the affected area after dissolving. 5. Jujube. It is the fruit of a famous herb which is reddish in shape and red in color, while its taste is also sweet like berry. Its common names are red date or Chinese date and known as its scientific name Ziziphus jujube. It has a mild temperament in both heat and cold. It removes waste products from the blood and reduces the temperature of heat in the blood. It soothes and cools the body. Eliminates from the body as an anti-inflammatory substance and is especially useful in all skin diseases and shows good effects. It also eliminates polyps and also removes acne, pimples and freckles. 6. Clove. A tree called a clove tree has dried buds. Its color is reddish-black. Clove known its scientific name Syzygium aromaticum and belongs to Myrtaceae family. Clove has a bitter and pungent aroma while its aroma is very pleasant. The temperament of the clove is hot dry 3rd degree. Its specific functions include dissolution and excretory properties. Acidic and other waste products that enter the bloodstream that have taken the form of swelling, tumors or polyps. Clove removes these wastes from the body as waste. Clove is also known for its excellent properties in treating bad breath and gingivitis and bleeding. For this reason, it has important properties in eliminating the malignant symptoms of polyps and similar swollen warts inside or outside of the human body. 7. Cinnamon. Cinnamon is the bark of a tree that breaks down easily. It has a bright red color while its color is dark brown on the inside. Its taste is sharp but sweet and fragrant. Its temperament is hot and dry 3rd degree. It belongs to Lauraceae family and known its botanical name Cinnamomum zeylanicum. It is an important ingredient in every home kitchen. It is effective especially nasal polyps or similar objects that have a soft or hard lump in any of the organs, has the property of dissolving them and expelling them from the human body. Herbal tea for nasal polyps. Here is a potential herbal tea that not only dissolves nasal polyps but also removes waste products from the blood so that the body is protected from such diseases and especially skin diseases and blood is dirty and stay clean of contaminants. Ingredients. Jujube 50 grams. Raisin 50 grams. Cinnamon 50 grams. Clove 50 grams. Preparation. Put a cup and a half of water in a teapot and now add 2 grains of jujube, 2 grains raisin. Add 2 grains of cinnamon and 2 grains of cloves. Rinse on fire and boil till 1 cup of water is left. This is the weight of a one-time tea. Use. 1 cup in the morning and 1 in the evening. Hope you like this video very much. If you want to watch more videos on different health topic, then please subscribe our channel Herb Concept or visit our website www.herbconcept.com.